Good morning, everybody. My name is Dr. Mata. They call me Dr. Scottsdale. I'm a board-certified plastic surgeon. I help people be their own kind of beautiful. Watch me as I give natural results on this Wednesday as Jordan looks a little sleepy. So I am at the overnight facility because the patient from yesterday had more than 10 pounds of liposuction, so she had to spend the night. So this is what it looks like. Pretty nice. Hey guys, so this morning we have a J plasma to the stomach. This is a patient of mine that I did Lipo 360 BBL on about 3 years ago, and she lost some more weight after her lipo, and she has some skin laxity, but she also gained some fat in places that she still doesn't like. So we're gonna do a little touch-up lipo, and we're gonna do J plasma to her stomach to cause the skin to tighten. So I'll post her before pictures. Kind of catch. So actually start with this, which is called a Toledo, which helps to release this scar right here. It's kind of stuck. See? All of a sudden, if I can get this scar to come up after her this helps to get that C-section scar smooth from this, because you can't see it on the picture on the TV, but she sees it, and in the video you can see it. This is the part that causes the belly to kind of. So we're starting, man, it is certainly, I can feel where I smart lipos versus regular lipo. You can hear the crunch. That's the scar tissue. Crunch, crunch, crunch. And I can feel it. And that's what you want. Anytime you do smart lipo or laser lipo, you get scar tissue formation. That's what causes the skin to shrink. So now we're using the laser to help break through some of that scar tissue and help tighten the skin without creating so much scar tissue. You can hear it. Now we're going to do a little bit of lipo on the upper abdomen. Well, we're not expecting a ton of fat because she's really thin, but we're just trying to get this lipo here. You can see it's thin. This, we didn't do any lipo because she didn't need it. It was just right here. So this is just swelling here. Now we're going to start with the plasma. You see it? And you can see the skin as I pull it just shrink down. But I just
you want the leak out
through the other ports, correct?
Okay, right. Real self, we've been around for 17 years, and we still have a 92% on real self. Which is pretty good.
It's not versus this. Look at this. It doesn't, and that's how you know you're reaching your clear DNA. All right, guys. So we are done, and you can see here. Remember before when I started the video? Look at her skin. I should be able to pull her skin more when we do this. And you can see the skin just doesn't move the way it did on the before video. It's tight. So that's it. That's all she wrote. so this is the before. We got all this extra. We're going to try and thin this out as much as we can and get it to tighten as much. And if we need to, maybe do a little cut in here later so that it looks not so big. Flex for me. Look at those muscles. But look at all this
I actually have muscles, but
you do.
You know,
look,
yeah.
But look at all this extra skin.
I know.
And that's what we're trying to get rid of. Hey guys, so we finished the first case, which was J plasma to the abdomen, basically for skin tightening, not so much for the lipo, just a little bit of upper lipo up here. The next case we have is an arm J plasma. We're going to be doing a lot more lipo on this couple of arms on a previous bodybuilder who she lost a lot of weight now because she's not working out as much, and so her skin started to sag. So it's not the perfect thing because, again, she needed a brachioplasty or an armless surgery, but she doesn't want the scar. So this is the next best thing to having an armless surgery without the scars. So I'll post her before pictures and before video. Check it out. So we're starting with the vaser part. This is to create a level of smoothness. How you doing, sweetie? You okay?
Good, thank you.
All right.
Relax.
Our patient's awake when we're doing this. It's just a mild sedation. Any pain?
No,
Awesome.
feel good.
All right, so now we start with the lipo part. See how all of a sudden there's some definition there? So this is a little bit of the definition that we can do for males or females, so the arms look a little bit buffer. So we do that, and all of a sudden the arm looks more muscular. Okay guys, so we're here, and you can see the skin's becoming lax. That's where we have to do J plasma, because we're getting rid of the fat now. So we have extra here that we still have to do, but we need that skin to tighten. So that's what the J plasma is for. Perfect. Great. So look at this. Right? And you see the gas getting activated there. It's tight, instant tightness. Okay guys, that's pretty much it for today. So we did 2 J plasma cases, which is instant skin tightening. And J plasma is nothing more than helium gas under the skin activated by radio frequency. It basically causes the skin to shrink and tighten instantly, but it gets even better up to 6 months after surgery. So if you imagine, like, let's say the laser or ultrasound or radio frequency by itself, that gets 10, 15, maybe even 20% improvement. J plasma at least gets 30 to 80% depending on how it's done. So it's kind of like a Ferrari compared to the Toyota. That's what I would say about J plasma. So that's basically what we did today. On the first lady, we removed about 200 cc's of fat because we weren't doing it for lipo, but for skin tightening. The second case, we did 1 pound of fat removal per arm of liposuction. And again, the reason we did this as opposed to a brachioplasty or an arm lift is the lady didn't want the scar. So sometimes when we do J plasma, yes, it's not going to make her arm perfect, but it'll make it skinny enough to where we only have to do a mini brachioplasty where the scar is basically in the armpit only as opposed to up the entire part of her arm. So the scar is hidden better. But anyways, that's what we did for today. Anyways, have a good night. Keep snapping away, and we'll see you guys tomorrow.